Okay, welcome everybody to my webinar, When to Worry, Colds, Coughs, and Trouble Breathing. So super excited to have you here, those of you who are live and those of you who are catching the replay. So I'll be answering questions live here, but if you have questions afterwards, you are obviously welcome to send them to me, but also set up a virtual session if you'd like to talk about it more. Okay, so I'm so excited that you are here tonight because that just shows you're just a really proactive parent, and I love that because I love teaching parents the things that they want to know in order to stay at home when they can and to go in when they need to. So that's my goal for you today, is to feel a little bit more confident in that decision-making process. So that's what we're here for. And again, I can't cover everything, but this topic is so important, especially because RSV cases are rising right now, and we're heading into what we call in pediatrics RSV season, which just means it just kind of overtakes our lives as pediatric providers because we see so many of these kids trouble breathing. So my goal for you today is to feel better because you know more by the end of this. Okay, so we'll go ahead and dive in, and then I'll stop for questions regularly, and then we'll do a Q&A at the end, in case there's some things that I missed or other questions that we have. So we'll dive in here. Okay. So, like we said, the topic today is coughs, colds, and trouble breathing, when to worry. So, my goal is to talk about those three things and let you know some signs that means that your kid needs to be seen, or maybe potentially even going into the hospital, right? And what are like worrisome signs for all of those things and what's normal, especially when it comes to colds and coughs. But first of all, some of you know me. Some of you have interacted with me before or used my services, but some of you I'm brand new to. So I'm so glad to have you here. My name is Dr. Laura Vanston, and I am the owner of Inspire Pediatrics. So who am I and what's my background? Why am I qualified to even talk on this subject? So I've been working in pediatrics my whole career. I'm a pediatric DNP, which stands for Doctor of Nursing Practice, which means I have a background as a nurse practitioner. And I just kept going to school because I'm addicted to learning and learning more so that I can help my clients and patients better. So I have been really trending to a really holistic and integrative viewpoint of medicine, but I have a strong foundation in traditional medicine, which means I feel like it's the best of both worlds. I like blending things together. So, I love to like not have intervention if we don't need to, or have like more natural remedies. But then we need to, then you use the traditional healthcare if you really, really need to do that. And that's a strength of mine. I've worked in the ER, urgent care, even up to ICU and outpatient clinics my entire career. So, but then I've learned a lot to help parents along the way. So, and I'm also a mom, that's for my background. So I've been a mom way less time than I've been a nurse practitioner. I've been a nurse practitioner since 2009. As you can see here, my little guy Finnegan is hilarious, and he's a little spitfire, and he is really, really fun. And so I've worked with parents since, 2006 when I became a little brand new baby nurse. But now I've gotten to go and test my theories, and I've gotten to use that all on little Finn. And then I've gotten to learn more, like kind of from the mom side of things. So that's been really, really fun. So I started Inspire Pediatrics because my goal is to help parents go from anxiously Googling symptoms to having confident peace of mind. I've been that resource for all of my friends and family for my entire career. Like everyone has texted me with questions or concerns. Not sure if they need to go into the ER, or like, hey, do I really need to go in for this? Hey, can you stop by and see my kiddo? So I decided to solve that problem with my business. So I do this through virtual support, in-home visits, parent classes, and guides, which I'm going to talk about a little bit in case you have any additional questions that I didn't answer here today, because there's so many tangential things, right? I would love to show you how you can interact with me, and how I can help you. So the core of what I do, actually, this is how I got started in Inspire Pediatrics, is that again, I've been that like texting friend for everybody. And I thought to myself, well, what if somebody doesn't have me in their life and they want someone that they can just text and have easy access to? I started out by offering subscription-based texting services. So you can do unlimited text calls and video visits about anything and everything with your kid if they're sick, if you just have a question about development, if you need help navigating like which specialists to see for different things, or even if you just want a little bit more explanation about things like starting solids, I do all of that. I can see newborns all the way up to 18 years. I do see more of the like newborn to like school age kiddos because those are the kids who get sick more often, right? And they can't tell you as much, right? But I can see all the way up to 18 years. I love using technology to help keep you at home and healthy at home so you don't have to go into the office. So with all of my subscription services, I offer a telemedicine kit. So you can actually diagnose ear infections at home, look in the throat, all that fun stuff, which is really great. I do illness and wellness support, so the like a little bit of everything. And just because people ask me this a lot, I can prescribe medications. So let's say we diagnose an ear infection with my camera that takes a picture of the eardrum, then I can absolutely treat that as well in the state of Colorado. So this I can do anywhere in Colorado. So if you're anywhere in Colorado, you're in luck, you can sign up with me. I also, if you happen to be in the Denver metro area, I do house calls as well. So you can do a lot over texting, but you can't do everything, right? And so if you need someone to listen to your kid, you need someone to get vital signs. If you want someone to check oxygen level, if I'm going to do some like a rapid strep test, I can do that. I can do a lot of things that you would do in the office, but in your home so that you don't have to disrupt your whole day so that you can, get it done there. You don't pick up any more germs in the ER, urgent care, or office waiting room. So that's really fun too. So if you're in the Denver metro area, I have a service map on my website if you're interested in that too. There may be some of you, and I saw some of you who signed up are not in Colorado. And so either if you're in Colorado or not, I also have been working really hard on a set of guides. So these are things that I've written on lots of topics that have to do with kids. These are all based on conversations I have had throughout my career. And so I have ones on altitude. So let's say you are bringing your kid up to the mountains, or you have family coming into the mountains to do a ski vacation, or coming up to Breckenridge for a summer hiking or just like mountain vacation. What do you have to think about with kids? We'll talk about the different things I have offered for illnesses as well. I also do regular baby development, so baby basics. So if you have a newborn or know someone with a newborn, this baby basics guide goes over sleep and lots of normal stuff. And then also things like starting solids. So my guides, all of them include a downloadable PDF, so you can keep it on your phone for handy reference in the middle of the night. They mostly include video content, and some of them include pre-recorded classes. So this is actually going to go into my cold care guide, my cold care bundle for future reference if you wanted to be able to have access to it for longer. And I'm adding more every month. So you can actually sign up for a subscription to my guide so you can have access to all of them and everything that I'm going to release in the future, which I have a lot of exciting things. So those are all the ways that you can interact with me. I can do virtual visits and virtual coaching if you're not in Colorado as well. So that's what I do. But so now let's just dive into the topic. So now you know how to interact with me if we don't answer all of your questions today. But this is the goal of today's talk. So we're going to learn about normal colds and when to worry. We're going to learn about coughs and when to be concerned, trouble breathing. And this is actually the bulk is what we're going to talk about, trouble breathing, and that's like the goal for me is for you guys to understand what to look for. This is very, very important. And then other things that you might want to look out for that might indicate that your kid is maybe struggling a little bit more. And then what we'll do is we'll just pop questions in the chat and I'll answer them as I can if there's anything that you have questions about. Okay. So that's what we're going to learn today. Again, it's not everything, but it's going to cover a lot of very important things, but really crucial stuff that I think every parent should know when they have a kid with a cold. So cough, cold, and trouble breathing. This is actually a picture of my little one, Finn, when he was sick one time. I couldn't help but, grab this photo, but poor little guy, he was trying to be so happy, but he was having a hard time with that congestion. So I've been through the ringer with it too. So don't worry, I'm no stranger to how hard it is to have a sick little kid. So what is normal when we think about colds? So colds, studies show that kids have 3 to 8 colds a year on average. So this is like average kid colds, right? So this is anywhere from like infancy all the way up to like school age to 18. So the 3 to 8 a year on average. So But what we find is when we look at kids who are in daycare or preschool, that increased exposure, that increases to 10 to 12 colds per year, which is just wild, right? That's a lot, a lot of colds. And so each cold can last 10 to 14 days too. So, and think about it, it's like compressed into certain times, right? Because in the summer, you're usually not fighting all these colds, right? So it's compressed into the winter. And it's compressed into when these kids are younger. So what happens is we often have a season where kids are just sick all the time. I kind of jokingly call it a permacold. You go from one cold to the next cold to the next cold to the next cold, right? And so it just feels like we're a little defeated sometimes. But why does this happen? Why parents always ask, why is my kid always sick? Why should I be concerned about this? A couple of reasons why this happens is we live in a world where there's a lot more exposure than there used to be, especially if you live in a large city. There's a lot more people interacting all the time. People travel a lot more. So if you flew somewhere for Thanksgiving, for example, this year, you are exposed to not only stuff in your home, but then the places like the place that you travel to, and then in the airport you get a little bit of everything from everywhere, right? And so viruses travel globally very fast. And so when you go to a new place or you're exposed to something new that's from somewhere else, there's different mutations to the virus. So your immune system isn't familiar with that one. So you get sick again, right? And so this is why you often get sick when you travel. Also, there's more than 200 viruses that can cause the common cold. So this is just the common cold. This is not hand, foot, mouth. This is not like croup. This is not like anything else. This is just the common cold, our standard runny nose viruses. So there's a lot of opportunities to get sick out there. Another reason kids get sick is their immune system is still learning, right? So once your immune system has been around the block a few times, they've seen enough viruses that your immune system kind of has like a memory a little bit. It's like a little bit of a library of like, oh, I've seen this before. This is how I fight this bug, right? Little kids don't have that quite yet. So that's why, that like you might not get sick from every bug, but they'll get sick from every bug. So I have to get some water. So again, it's going to take some time for their immune system to get the hang of it. And especially little babies, like their immune system is still young, it's immature, right? So on top of not having the exposure knowledge, their immune system is still learning how to function, right? And the last reason is when you've been sick. So first of all, I don't know anybody who just stays home for 3 weeks when they have a cold, right? Which is really what it would take to fully recover from a virus. But it just doesn't make sense, right? Especially in our busy lives. So we're on to the next thing. And if you feel fine, especially if your kids are crazy, you're going to go out. You're going to go with around other people. The problem with that is when you have recently fought off a bug, you can pick up something new really easily because your immune system is still kind of depressed for a little while after you fought a virus. This happens all the time. And so when you encounter something else, like you might have not gotten sick from this particular bug, but you're a little down from before. And so when you encounter the next one, then you just pick it up easier, right? So this happens pretty frequently with kids. So that's why kids end up being sick a lot. But when is a problem? So first of all, if you are concerned about your kids' health and the frequency of their illnesses, you really should have contact with a trusted healthcare provider that doesn't make you feel stupid for asking. And is willing to put in the referrals if needed, or at least walk through and listen before they say, oh, that's normal, right? Because yes, it often is normal, as we just reviewed. But I think it's important that they look at your particular kid, ask a lot of questions, and then give advice or let you know that it's normal. And so if they don't do that, then I would be concerned and maybe getting another provider or have someone like me in your back pocket if you need anything at all. Okay, so but here are a few things that definitely are red flags as far as immune system problems. Again, there's other ones, but these ones, along with being sick all the time, would make me concerned. So if a kid isn't growing well, so if they're not gaining weight, if they're not getting taller, they're not growing out of their clothes like they should, then I get worried about that. If they're very low energy and not able to keep up with other kids around them, if they're just kind of like they're not running around, and again, like when they're actively sick, they're not going to, but in general, they should be keeping up with other kids their age. That would be concerning. If we have like prolonged fevers, like with a virus, you can have a couple of days of a fever and then it should go away, right? So 2 weeks of fevers is a long time, right? Some kids have that, or recurrent fevers, like we call them, like cyclic fevers. So like a fever every month or a fever every so often. If you feel like your kid is in that pattern, it's good to record it so you have that information to bring to a specialist. Kids who have pale skin, pale mucous membranes. So mucous membranes means the parts of your mucosa that are usually pink. So like the inside of your eye right here, where it's to be nice and pink, inside your mouth and lips, that should be nice and pink. If that's pale on your kiddo, that could be a potentially worrisome sign, or if they have easy bruising or bleeding. So you don't know where this like bump came from. They just barely bumped into something and they have a big bruise. Or every single time you go to brush their teeth, those gums are bleeding. Lots of recurrent nosebleeds. This is a plus minus in winter because we get dry noses, but that is on the list of potential bleeding areas. Or if kids have joint pain or swelling. And usually this means that they have like a limp, or these kiddos aren't running around as much because they've got joint pain or swelling. So again, that's not exhaustive, but those are some signs that you should definitely get checked out. And then before we move on to coughs, I wanted to talk about a couple of myths for colds. Um, just because I hear them all the time, they somehow just keep making it generation after generation. But colds are not caused by going out into the cold. And I actually really believe that fresh air is good for a kid, even when they're sick. Now, of course, when you're sick, you shouldn't spend like all day out in the cold, especially if it's aggravating a cough, right? But a little bit of fresh air is really good. Um, and sure, if you spend all day out in the cold, maybe does it depress your immune system a little bit? Sure. But what happens is when it's cold outside, everyone wants to go inside and go hang out together inside. And then more people have colds, and then they pass it to each other, and then more people have more colds, right? And there's so many viruses everywhere, all indoors without the ventilation. That's what causes a lot of colds. So it's not caused by going out in the cold, and I'm a big proponent of fresh air. Not color. People tell me all the time what color their mucus is. I mean, I don't know about you, but I also check if I like blow my nose, right? Um, but it doesn't really mean anything. It means little to nothing to me. So it doesn't matter if it's green or yellow or whatever. Lots of viruses can cause like lots of colors of boogers. So it's really not a big deal. It doesn't necessarily mean it's bacterial versus viral. So that's something I have to kind of unteach a lot. And still everyone kind of clings to it. They're like, oh, but they have green mucus this time. And I'm like, depends on a lot of I care about a lot of other things a lot more than if they have green mucus. So that's not color. Don't worry about it. Just let it go. And then allergies. So I think we're always looking for, like people are always looking for a reason for why their kid has had a runny nose basically straight for like weeks and weeks and weeks. But usually goes that pattern like it gets better and worse and better and worse, right? Um, Kids who are little, especially like under 3 years of age, don't typically have seasonal allergies because they haven't been around these allergens enough to get the exposure to become sensitized. So it's pretty unusual for kiddos to have like see like like ragweed and things like that. So some people will try some antihistamines, and I'm like, does it really help? If it helps, that's fine. But if not, I would not continue to give that medication if it's not really helping. There was a question about what about allergies to animals. It is possible to have an allergy to animals sooner because especially if they're around all the time, that animal. And especially a lot of times it's like breathing in their dander and stuff. So if an animal lives in the house, and sometimes we'll see that a little bit earlier. It wouldn't be like in a 6 month old, but you might see like a 1 to 2 year old really starting to develop those symptoms. So that is possible. But again, something that you like are only around every so often isn't going to necessarily be that. And again, it's not impossible. There's some kids who are just very allergic, and especially if you have a family history of allergies. I'm not saying it's never, but more often than not, that's not actually the culprit. It's usually the back-to-back viruses, especially if it's like in the winter, right? And people are like, oh, it's just allergies. And like, oh, what are they reacting to really? But again, yeah, if you have a pet or something like that, it's something to consider. And again, that's just something to talk about, like on an individual basis, and then see if maybe testing might make sense. Okay, so those are some myths. Okay. Any other questions about colds before I move on to coughs? Okay, perfect. So let's talk a little bit about coughs. What I really want to do is give my perspective on cough first, not to minimize how disturbing a cough can be, but from a medical perspective, a cough to me is a protective system first and foremost. What a cough is doing is it's bringing mucus up and getting it out, right? So it doesn't settle into an infection. So that's what, like, your whole airway is meant to bring stuff out and cough things up, right? It's actually very, very, it's good that it's doing its job. So, that being said, I know it can be really hard with a little baby who is having trouble sleeping because of a cough. But that being said, I prefer soothing remedies over cough suppressants. And actually, there's been a lot of like medication shifts over the years. We don't really use suppressants anymore in kids because it's not, there's a lot of side effects and it's not good for them because we want them to get it up and out. So again, that's hard. And I have in my cold care guide that I just released today, actually, I have a lot of the different remedies that you could use depending on what age. So I have medications and then also herbal remedies to see what actually helps with cough, because there are things that can help with cough, but aren't necessarily suppressing a cough. Okay, so like cough syrup isn't great for a lot of reasons. And you can read that on my cold care guide. But anyway, so coughs in general, remember, even when it's hard, that it's in general a good process. Okay. Um, so red flags with coughs. Oh, what did I just say? Sorry, I think I just navigated off for some reason. I don't know how I did that. There it is. Sorry. I don't know how I did that. Yay, technology. Okay. Red flags for coughing. I have a lot of windows, so that's how it happens. So red flags with coughing. So a cough that lasts more than 2 weeks is something that I think should get checked out. And so the reason why is because like could it still be normal? Sure. Or if it's getting worse after 1 week, that's the other caveat, because typically coughs are worse over the first couple of days and then they get better slowly over the course of a week or two. So whenever a kid has a prolonged cough, I want to know why. What is the cause of that cough? Is it because they have a pneumonia or a different kind of infection? Is it because they have wheezing in their lungs? Is it because of something else that's going on? Like, what is this prolonged cough? Things like pertussis, which is whooping cough, can have a prolonged cough as well. Or if you follow me on Instagram, I did a post about mycoplasma, which is a type of bacteria that can cause like a slower onset sort of cough that kind of continues and gets worse. So over 2 weeks, I start to really wonder why. And it could be because you've had back-to-back colds, maybe, but it also could be something else. And so the longer it goes on, the more likely it is that it's something else. So I would recommend getting checked out. Another red flag for a cough is what we call a barky cough. So this isn't like a dog barking. This is actually a seal barking. So a very tight kind of barky cough. Um, this could be an indication that your kiddo has croup, which is an upper airway swelling that happens with a virus. So I have a croup guide as well, that's going to be in the cold care bundle, which is croup, RSV, and cold care all together, my three guides. So that will give a little bit more information about croup exactly and how to detect croup and how to treat it at home and when to go in for croup. But that barky cough is something that would need attention and attention sooner because it tends to get worse before it gets better. A wheezing sound with cough, which can be a lot of things. It could be croup. It could also be things like asthma. If you start to notice like a wheeze is like a whistly kind of noise, that would be concerning to me. And it's just at least worth getting checked out for that. And then a big red flag for me is if your baby is turning blue or purple around their lips when they cough, they just need to go into the ER. Like that's not something to muck around with because that tells me that their oxygen level is dropping when they're coughing. And that's concerning to me. Any kind of color change. Okay, so those are red flags with cough. Any questions about cough before I move on to trouble breathing? Okay, great. So increased work of breathing. So this is the most important part of the talk today. So this is the signs that you should be looking for, and we'll talk about what to do if you see these signs of increased work of breathing. So this is when someone says, is your kid having trouble breathing? Are they breathing harder or faster? All of these things that as a parent, you might not have any training or education in, but suddenly you're supposed to know what this is like. So this is why I'm going to share this with you today. So increased work of breathing. First of all, why do babies have different signs of increased work of breathing? Why is it different in kids than in adults? So kids are just built different. And so this is one of the big things that was like drilled into me in pediatrics is that kids are not little adults. They are just everything's a totally different ball game, and it goes all the way down to when they're like newborns, to when they're like closer to being an adult. Once they're like a teenager, then they're a lot closer to an adult, but there's still a lot of differences and changes, which you guys know that too. But this is why it's very important to go to somewhere who like someone who is trained in pediatrics specifically, who sees kids as their career, because they will know the difference and know what to look out for. Okay, so really important. So babies, first of all, are nose breathers. So babies need to be able to nurse or take a bottle and breathe at the same time. So they breathe out of their nose first and foremost. So if that's blocked, then they have a lot of trouble and can actually be in, really get themselves into an issue because they like need to breathe out of their nose. That's just a big problem. Babies in general have small airways, and kids have smaller airways than adults, smaller lung volumes. So they need to breathe faster, and they're a lot more vulnerable to swelling and other issues in their whole airway from top to bottom. Okay. They also have a narrowing in their airway. So adults have more of an airway like straight up and down like this. Babies have like this narrowing that creates more of like a funnel, which most of the time is fine for them. But when they have something like upper airway swelling, like croup, this could cause them to have really severe trouble breathing. So that's a really big problem too. And that's why you can get the same virus as a kid or a baby, and they will get really sick from it, but you might be okay with it, right? So that's part of it is all these airway problems make it a really big different ball game for kids. Also, babies and children have more like give to their chest wall. So adults have more of like rigid airways. But babies, like and kids, it's more flexible. And so what can happen is that, like it's easier to like collapse in than adults are, right? And so and it like if they're really subject to a lot of issues when they have things like swelling going on. So those are, and then what happens too with that extra give is they show these extra signs in their chest and their belly. So if they're having trouble getting air in and out, they're going to pull in all these different places that most of the time adults don't do. So I don't think you can actually check how a kid is breathing unless you look at their belly and chest without clothes on. So you need to see their chest and belly. And so if you go to someone and they don't like look under their shirt, you need to get someone new because they really, really need to take a look, especially if they're having a lot of cough or breathing fast at all. So that's really important. And honestly, you can tell so much just by looking at a kid breathing. For my texting service, a lot of times I'll just have families send a video in of their kid breathing. And I can tell so much just from that like little video, how fast they're breathing and seeing these signs of increased work of breathing. So you will be able to tell this too. So that's really exciting for you. Okay, so before we talk about signs of increased work of breathing, a little note about RSV, because I think a lot of you are here today because of RSV. RSV season is upon us. So RSV is a virus. It's a respiratory syncytial virus. It's a very common virus, but it can be very serious under the age of 2, especially. And the reason why it's serious is because it causes a lot of swelling and tons of mucus, and it causes this syndrome called bronchiolitis, which is that inflammation of mucus of the middle and lower airways. And it can cause kids to require breathing support and sometimes hospitalization. Okay, this is one of the most common reasons kids will get admitted for breathing problems is RSV. So again, there's other bugs that can cause bronchiolitis too. So and it matters, but it doesn't matter if it's RSV versus something else. But that being said, RSV is a particularly notorious bug, and that's why I have a whole guide on RSV specifically, okay, of what to look out for. So this is like especially important to know if you have like a newborn or a kiddo who's under one. Those are the kiddos we often see being admitted the most. So what to do if you see any of these signs that don't worry, we're going to get to the signs here in just a little bit, but I just know as a parent, you're going to be like looking at these and be like, oh, shoot, what would I do if I saw this kiddo breathing the way that I see them? So we're going to go over what to do first before we show you the videos and the signs of what to look for. Okay. So if you see any of these signs that I'm going to show you, you need to have your kiddo evaluated. At minimum, like you need someone to look at their breathing. So like when people send me those videos over text, that can tell me a lot because if it's totally fine, the rest is probably fine too. Okay. Especially having a conversation about it and just seeing other symptoms too. If A lot of times, depending on what their breathing looks like, an oxygen level can be helpful. Checking to see like, is their oxygen level normal or is it low? If it's low, obviously that means that they may need some help. And also listening to the lungs can be helpful as well. Like what is causing this? Is it pneumonia? Is it bronchiolitis? Is it wheezing? What's going on in the lungs, right? And so you definitely want to have them checked out or talk to somebody about it if you're concerned. The second thing to do is to watch them closely. So just because you bring your kiddo in on day 2 of your illness doesn't mean that you're in the clear. Because RSV in particular can get worse on days 3 through 5. It does something called peak. It peaks on day 3 to 5. So in those days, I always worry if a kiddo is borderline on day 2, I really worry what's going to happen on day 3 and 4, right? And so if you go into the office and they say you're clear and they don't tell you to keep looking, I feel like that's a really big problem and something that I see pretty commonly, especially very early on in an illness. Things might look okay and it could be 12, 24 hours, we're ending up in the ER. So it's important to keep watching them. But if we're like day 5 or 6, usually we feel much better about it, right? We're probably in the clear at that point. The last thing to remember is if your kid is having trouble breathing, we want them to be in what we call their position of comfort. So depending on your kid, if they're really little, they're not going to have a position of comfort because they just are laying down until they're starting to sit, right? But sometimes as kids get older and before they can like verbalize things, what may want to do is to sit up and lean forward when they're breathing if they're having trouble breathing, because it's easier for them to breathe in that position. So if that kid flips out when you lay them down, especially if they're showing these signs of trouble breathing, as much as possible, have them in that position of comfort. That might be holding them upright, it might be letting them sit. Whatever it is, we want to try to minimize the amount of time that they're in a position that makes them have more trouble breathing. So I know that may sound kind of scary to you, but I think a lot of people don't recognize that's happening. Like if a baby's really fussy, and they're having trouble breathing, it's because they're having trouble breathing. They're not trying to be a punk. They're not like, they're just telling you something, right? And so if they are really fussy in a particular position, especially if they're breathing fast or hard, then we need to listen to them and pay attention to that because kids are smart and they naturally do what they need to in order to breathe better. Okay. So that's our what to do. Hopefully you're not like, I feel like sometimes when I talk to parents about this, like the anxiety goes up a little bit. But just remember, you are learning this, so you are already 1,000 steps ahead than just being taken by surprise. And you already know what to do and know what to look out for. So I'm not trying to scare you, I'm trying to empower you. So if you're feeling a little nervous, it's okay. You're going to do great. So the first sign, we're finally to our signs of trouble breathing, guys. The first sign is called retractions. So that means skin sucking in between, above, or below the ribs. So this kid that is here is not just skinny. So you can see the outline of the ribs and we'll see a video of this exact kid later. But you can see the skin sucking in. That's what happens every single time he takes a breath is that skin sucks in. It means they're using every muscle they can to get air in and out of their lungs. So retractions is something that I mention it first because it tends to be the easiest thing for parents to see and be able to understand and pick out on their own kids. So retractions is something that I would definitely look out for. So that skin sucking in. The second thing, I zoomed in on this kid's belly. This kid isn't like just doing a lot of ab work, right? So this kid is actually using the muscles in their belly and they're tense and crunched up because they're using their belly to push air in and out. So that's called abdominal breathing. Okay. It's using extra muscles in the belly to breathe. So, and again, you'll see what this looks like in action. And little babies, it looks a little bit different than a slightly older kids. So I have an example of a baby and an older kid. Okay. The third one is kind of, you might see it, you might not, but it's just an, if you, like, you wouldn't see this by itself, by the way, you would see this in the context of like abdominal breathing and retractions too, but his nostrils will flare out. They're trying to like get as much air in as possible when they're having trouble breathing. So their nostrils will flare. Again, if you see your kids flare the nostrils, that can be for a lot of reasons, but if you see it in the context of everything else, that could be an additional sign that they're having trouble breathing. Okay. The last one is grunting. So I put this in here. A lot of I hope you never have to see grunting. But if you see it, especially in the context of all these other things, it just means we're really really struggling. So grunting is forceful expiration where they're trying to keep their airways open. So it sounds like this. It goes like with every breath they do that. And so that is a very concerning sign. If that's the case, this is something I would call an ambulance for. I wouldn't like strap this kid in a car seat and go like drive 30 minutes. I would actually call someone to come to your house, not me, but the ambulance to come to your house instead. But that's a really late sign. So if you ever see that, that is something that's really concerning. But what I'm hoping is you catch all the other things first, and then we don't get to this point, where they get that severe. So that's grunting. Another thing to take into account is how fast they're breathing. I don't want you to feel like you have to memorize this chart. I want you to take home the fact that um, counting breathing is actually a very helpful exercise. So what you should do is look at your kids breathing and count for a whole minute. How many times do they take a breath? Okay. And is my job, it doesn't have to be your job to see how, like, what's normal and what's a normal range. But I just want to show you how drastically different this is. So, like, an adolescent or adult is like 12 to 16 breaths per minute, but a new baby could breathe 50 to 60 breaths per minute, and that could actually be quite normal. But it just kind of depends on a lot of things. So it can be really tricky when they're little to say, okay, is this problematic fast breathing? But what I will see sometimes is these kids breathing like 70 breaths per minute, like little babies, and then I get worried about those kids who breathe 70 breaths per minute. And again, this is just a piece. There's a lot of reasons kids can breathe fast too, like fevers and stuff like that as well. So it's just a piece of information. It's not just it's taken in totality, right? So whenever I talk to families, I get lots of information, and this is one of the pieces of information. Or when they send me a video, I count their breathing, so I have an idea of what it looks like. So a whole minute doing that. And again, like a toddler, they start to slow down. So if a toddler's breathing 50, that's pretty fast to me. If a preschooler is breathing 40 to 50, then I'm worried. So again, it depends on how old they are, how worried we are. Okay. So those are all the different signs. So I want you to be looking for these in the videos. And I think potentially the first video I might have to screen share to a different window. So I apologize if it doesn't play. But the other one should read just fine, or it should play just fine. It's like showing like a breathing video. So I want you to be looking for that. I want you to be looking for all those different signs. And what I would like you to do is drop in the chat what you see. So it's kind of like a quiz. So if you're if you're joining in the replay, just be noting that to yourself and just like maybe call it out because I feel like that really helps you remember. Okay, so let's see if this next video plays. If not, I will share it. 1 second. All right, so the top one is a baby. No, it's not going. Oh, it's saying it won't do it. Okay, so let me share. One moment. I have it in another window. Okay, and I think hopefully it works in video clips. Okay. But either way, we're like looking for more of the visual. Okay, here we go. Yeah, definitely can see a dramatic rise and fall of the chest, absolutely retractions. Yeah, and then we have that abdominal breathing. So there's in this baby, so I'm actually going to share it again too. What I want you to note is in this baby, um, you can hear me, right? Can you just let me know you can hear me? Okay, good. So in a baby, you might not see what we call intercostal or in between the ribs retractions. You might really just see below the ribs. So I'm going to go back and just play it for just another second to show you guys again what the retractions. So the belly we see very strongly in this, but you can also see the that what we call subcostal retractions. Oh, sorry, one second, I lost the share. Okay, um, show that one more time. Oops. There we go. Okay. So there's that. Sorry, there we go. Okay. So did you see oh yeah, like yes, there's like a line there. So you can see like that skin like tucking in, like that line right above the belly and below the rib cage. That's exactly it, totally. And then very fast breathing. Yes, this baby also has quick breathing. So good job pointing that out. That's perfect. So that's a baby. And then okay. I'm gonna do this. This is where I was going to discuss it. So that line underneath, we that under the rib thing, that's actually the most common place that I see this, especially in little babies. So the look if you have like a little kiddo under one, be on the lookout for that because you might not see the between the ribs retractions, which are a little bit more obvious. But good job. Okay. So this next video is actually a slightly older kid that was actually pulled out of the pictures that you see. So I actually screenshotted this kiddo just to demonstrate those things. So I just want you to see it looks a little bit different, but he has some similar things going on. But hopefully you'll be able to pick it out because I have those in the pictures. But yeah, feel free to drop in the chat what you see on this kid, but this one should just play. I'll play it one more time. All right. So did oh yes. Yes, exactly. Perfect. Yeah, intercostal space. Good listening. Space between the ribs. So that's perfect. Yeah, you can see the spaces between the ribs and then again breathing fast in that belly abdominal breathing there too. Yeah. So again, it looks a little bit different depending on the age group, but hopefully that is helpful to have a visual. And all of these videos and then some extra ones are also in my cold care guide and RSV guide too, if you ever like wanted um, some regular access to that. Okay, so that's trouble breathing. So you guys already have been great with that. So the last thing we're going to talk about is other things to look for. So again, you might see retractions, or maybe you'll see like some mild retractions, and you're like, I don't know, is that serious enough? You know, it's like overnight, right? You may this always happens in 2 in the morning. And what do I do? And how do I know if anything like needs to go in? Obviously, you can keep watching them and see. You put it all together. If it looks really mild and they otherwise look good, then you can consider watching them. But if they're like really tired then I start to worry, hey, are they spending so much energy on breathing that they're struggling? That would be concerning to me if they're just so wiped out. If they're not drinking, because that tells me, especially little babies have to prioritize sometimes. They sometimes have to prioritize breathing over eating, right? And so sometimes what I see with babies is they'll nurse or take a bottle and then they have to stop, take a couple breaths, and then they'll take some more. And that is a concerning sign for me, right? You know, so if the baby has to stop, sometimes it just means their nose is clogged. So sometimes that's like worth the conversation But if you're seeing all these other like signs of increased work of breathing, and they're really struggling to eat, and they're starting to show signs of dehydration, like they're not peeing as much, all of that together is concerning, right? And might tell you, maybe this means that I should be seen sooner. And then I usually expect with viruses for kids to have periods of activity where they feel better. So they may be a little punky, and then they perk up, and then they feel a little punky, and they perk up, right? If they're not doing that, if they're not perking up the play intermittently, then I start to worry about that. Or if they have extreme fussiness or sleepiness. So fussiness and a kid with trouble breathing, remember, this is them trying to tell you, I'm struggling here. I'm having a hard time breathing. Or really sleepy, it's like, I'm just kind of giving up because I don't have any energy to do anything else. So any of those things will tell you, hey, that's also kind of a red flag, for this is more serious. So we're getting to the end here. And so again, I just want to point out again, I have all of this and more that you can have at your fingertips. So if you're like, I don't remember, I'm in the middle of the night, what do I look for again? Have it on a PDF on your phone. I have clients I work with, they all have they all have access to my content included, and they just keep it on hand just in case they have a question, or if they're traveling, which is really great too, is a great thing to be looking out for. So all of my guides, the cold care bundle, which is RSV, croup, and cold care, it has all of the extra things. So best remedies for cold and cough, medications and herbal remedies, how to treat croup at home, best ways to keep your baby out of the hospital with RSV, and more, so much more. So you guys will have access to a special deal on my cold care bundle, which is brand new release today. So let's see, what other questions do we have? That's a very good question. So does trouble breathing look the same across different illnesses? Yes and no. Croup is a little bit differently. We might see more pulling in the right here. So like in the neck area or above the ribs for croup, because it's swelling up here. So we often will see it here first rather than lower down. So that's a really good question. But in general, things like pneumonia, asthma, to my trained eye, it will look a little different if it's asthma versus pneumonia versus RSV, because I've seen a lot of them. But in general, yes, they actually show the same signs. So for you, when you're looking at your kid, you may see retractions, abdominal breathing, breathing fast, and you're like, there's something going on. But then, it's my job to figure out which of those things it is by like looking at them breathing, listening to them, checking an oxygen level. Like you can figure it out with a lot of other pieces of information. But in general, most of the time, you will start to see some of those with any illness you'll see. So it's a very good catch-all for general breathing problems. And then your job is just to get them seen. So any other questions? Let's see. Wheezing and asthma in babies. Yeah. So wheezing when every time you get a cold. So for asthma, so it first of all, there's a really strong family history related to asthma most of the time. So if anybody had asthma, including childhood asthma that they grew out of, so people will forget a lot of the time that um they had asthma as a kid, like, oh, I grew out of it, I used to use an inhaler, or no one called it asthma, but they're like, oh, I used to use an inhaler, but I don't need it anymore, or I only need it when I'm really sick. So that's an important thing to ask around for yourself and your partner, or if you adopt, like, you might not have that history, right? But so in general, in little kids, a lot of people are hesitant to diagnose asthma under the age of 3. But what I just kind of say is, in general, if a kid like wheezes recurrently, and more importantly is responsive to the medication albuterol, which helps open up the airways, you might have one virus, or sometimes kids will have like RSV and they use albuterol for like just that bug, or one or two viruses. You can have wheezing with just one bug, and you don't necessarily have asthma. But if it happens recurrently and you need albuterol recurrently, or your provider hears wheezing in the lungs recurrently, then for sure that for me, I diagnose kids with asthma earlier than 3 for sure, because there's just sometimes it just makes more sense. Like if you label kids earlier, they get the treatment. But that being said, wheezing, it can be a little hard. For me, wheezing is something that needs to be listened to like with a stethoscope on their chest, because kids can sound wheezy when they're breathing just from inflammation, and sometimes even congestion in the upper airway. And it takes someone listening, like upper versus lower, to be able to figure that out. So that true wheezing in the lungs is what is associated with asthma. Like a wheezy noise, could be something else. So again, like you were saying, you were referred to ENT. So kids will have like recurrent wheezing with like enlarged tonsils or adenoids. They just get a lot of swelling from a virus, and then they just sound wheezy with every virus. So there's other things too that can cause that as well, like some floppy airway issues. There's a lot of other things, but the ENT is the definitely the person to figure that out. So all that wheezes is not asthma. I have also seen kids wheeze from, hey, I choked on something and it's actually still stuck in there, stuff like that. Like there's a lot of things that can cause like a wheezing noise. And I think again, a lot of it is like just a lot of questions over and history over time. But yeah, that's a really good question. But yeah, if you think your kid is wheezing a lot, definitely you should get them checked out, especially when in the setting that you hear it. It's ideally so that way someone can be like, okay, when you're hearing this, this is what I hear, and then where is it coming from? Is it coming from here or down here? Yeah. Any other questions? Cool. All right. Well, if we don't have any other questions, I know there's several of you who haven't been able to make it live. I would love to interact with you. So feel free to shoot me a message or set up a virtual visit if you have any specific things, or even better, buy my cold care bundle. So you guys will have access to this for 1 week. Okay. And then after that, it's going to go into the access for people who have memberships, or buy the bundle if you want to have access for this in the future. And then you guys will also have the opportunity to purchase at a discount if you want, or subscribe to my content. So I would love that. But please let me know feedback, and good luck out there. And I hope everybody stays well and that you don't need this at all. But good luck and have a good holiday season. All right. Bye bye.